All right, ladies, let's go ahead and start with chapter 7 study guide. I believe we're doing even. Is that correct? Okay. 2 is true, 4 is false, 6 is false, 8 is false, 10 is false. 2 is false, 4 is false, 6 is false, 8 is false, and 10 is true. 2 is G, 4 F, 6 A, 8 M, 10 N, 12 O, 14 B. Two, the age of the patient, the location of the application, circulation and sensation impairments, and individual tolerance to change in temperature. 4, the blood vessels constrict and the blood supply to the area decreases. 6A, the diameter of the blood vessels in the affected area constricts the blood vessels. B, the blood supply to the affected area decreases it. C, tissue metabolism in the affected area decreases it. 8, to immobilize a body part, to support and stabilize weak or dislocated joints, to promote healing after a surgical correction, and to aid in the non-surgical correction of deformities. 10, painful rubbing, burning, or stinging sensation under the cast. 12, to provide for patient comfort and to cover the rough edges at the ends of the cast. 14A, removing synthetic casting particles using an alcohol swab. If the particles are not removed, they may get under the cast and cause irritation. B, checking the circulation, sensation, and movement of the extremity to ensure the cast is not too tight. 16, increased pain or swelling that does not go away with application of an ice bag, medication, elevation, or rest. A feeling that the cast is too tight, tingling, numbness, or loss of movement of the fingers or toes. Coldness, paleness, or blueness of the fingers or toes. Painful rubbing, burning, or stinging under the cast. Foul odor or drainage coming from the cast. Sore areas around the edge of the cast, and chills, fever, nausea, or vomiting. 18, the skin is yellow and scaly, the extremity is thinner, and the muscles are flabby. 20, a stable fracture of the lower leg, such as a stress fracture. 22, the individual can release the hand grip, enabling hand. 24, well-fitting flat shoes with firm, non-skid soles to provide traction and stability. The patient should use correct posture. The weight of the body should be hands on the hand grips. The patient should look ahead when walking. The surface that the patient is walking on must be clean, flat, dry, and well lit. The crutches should be kept 4 to 6 inches out from the side of the feet when walking. Each step taken with crutches should be at a safe and comfortable distance. Tingling or numbness in the upper body should be reported to the provider. Extra padding can be added to the shoulder rest of your crutches to make them more comfortable. Keep the crutch tips dry. Inspect the crutch tips regularly. For wooden crutches, periodically check the wing nuts that hold the central strut and hand grips in place to ensure that they are tight. 26. A standard cane has one leg. A tripod cane has 3 legs, and a quad cane has 4 legs. And 28, for geriatric patients with weakness or balance problems during the recovery process from knee and hip joint replacement surgery. All right, make sure you send me your results for Chapter 7. And then we're going to turn our pages to 504 for Chapter 13. Introduction to colon procedures. Colon procedures are performed in the medical office or clinic and include the fecal occult blood test, FOBT, sigmoidoscopy, and sometimes colonoscopy, which are discussed in this chapter. The FOBT is a screening test used to detect blood in the stool for early detection of colorectal cancer. The patient must collect stool samples at home. Some patients initially may be reluctant to comply with the FOBT patient preparation requirements and collection of the stool specimens. The medical assistant can help by explaining the purpose of the test to the patient. If the patient understands the benefits to be derived from the test, he or she is more likely to participate as required. Medical assistants are often responsible for explaining to a patient the preparation required for a sigmoidoscopy and a colonoscopy. The medical assistant should make sure the patient thoroughly understands the instructions. If the patient does not prepare properly, the procedure must be canceled, which requires the patient to go through preparation procedure again. The medical assistant helps the provider during a sigmoidoscopy, and he or she should have a thorough knowledge of the responsibilities accompanying this procedure. Structure of the large intestine. Alicia, can you go ahead and read structure of the large intestine?
The medical assistant should be familiar with the structure of the large intestine. The large intestine is divided into 3 parts, which include the cecum, colon, and rectum. The cecum is the first part of the large intestine. It consists of a blind pouch to which the appendix is attached. The cecum leads into the ascending colon and joins with the ileum, which is the last part of the small intestine. The colon makes up most of the large intestine. It averages 60 inches in length and is divided into 4 sections, which include the ascending colon, the transverse colon, the descending colon, and sigmoid colon. The sigmoid colon is identified by its S-shaped curve and connects to the descending colon with the rectum. The rectum is located between the colon and the anus. The anus contains a sphincter muscles and often it opens to the outside as a means of expelling waste from the body. The primary functions of the large intestine include absorption of water and preparation of fecal matter material for elimination. Mucus is secreted from glands embedded in the intestinal wall mucosa of the large intestine. The mucus binds the fecal matter together and protects the wall of the large intestine from irritating effects of substances moving through it.
Very good. Okay, so in the first paragraph, you're going to highlight the second sentence. And in the third paragraph, you're going to highlight the first and the last sentence. All right. Anna, can you blood in the stool, please?
Yes, blood in the stools can indicate a number of gastrointestinal conditions, including hemorrhoids, diverticular. How do you say that?
Diverticulitis.
Okay, and I'm not on. Am I in the bathroom? That's like my son flushing his potty. If you can hear that.
No, that's okay. I
Okay.
got you. You're good.
Pylos, colus, upper gastro ulcers, and colorectal cancer. These conditions uh, produce visible red blood cells on the outside of the stool, making them easy to detect. Blood entering the stool in an amount of 50 milliliters or greater from conditions affecting the upper gastrointestinal tract causes the stool to exhibit melena, meaning it is black and tar-like. The dark color is a result of excitation of the iron in the blood by instill and bacterial enzymes. If a minute quality of blood is presented, however, it is not possible to detect it with the under 8 eye. This happens, or non-visible blood is termed osculent blood, and it. Hey, stop it. Its presence can be determined by testing the stool from the blood. For colorectal cancer is one of the most common forms of cancer in individuals older than the ages of 50 years old. During the early asmin at as how do you pronounce that?
Um, where are you at?
It's right there. It's the second sentence on
Oh, during the asymptomatic stages.
asymptomatic stages. All the lesions of the colon and rectum bloods a small amount of a intermediate basis, and this is usually in the form of ocular blood. Discovery of the ocular blood is the stool does not mean that a patient has colorectal cancer. It does, however, warrants further diagnostic procedures such as a colonoscopy to determine if the colorectal cancer is present. Early diagnosis and treatments of colorectal cancer increases the patient's survival rate. In most cases, when more pronounced symptoms of colorectal cancer starts to appear, for example, visible bleeding from the rectum, a change in bowel habits, and abdominal pain, the cancer has reached an advanced stage.
All right, very good. Okay, so in the first paragraph, I want you ladies to highlight the first sentence and the third and the last two sentences. And then highlight the last sentence in the last paragraph. So the best way to remember, so obviously we're getting into, so the chapter is over colon procedures and male reproductive health. So the first part is going to be our colon procedures. Now, sometimes some things will form and you will see some blood in your stool, okay? Now, the way I was always taught is if it is dark, like a blackish tar-like, and it literally looks just like that. That means it's what we call older blood, and it's coming from up further into the colon. Bright red blood means it's fresh, right? So that could be just as simple as maybe hemorrhoids or irritation from the anal canal, okay? And then, like with anything else, the early detection, the better, right? So that's what this chapter is going to kind of touch on. Any questions so far? All right, Jasmine, can you go ahead and read the first and second paragraph under the fecal occult blood test, the QUAC slide test?
Routine screening of stool specimens for occult blood is frequently performed in the medical office. The QUAC slide test is a chemical test used to screen for fecal occult blood and is discussed in detail in this chapter. This test is commercially available with the brand names of Hemoccult, Coloscreen, and Sericult. Fecal blood loss greater than 5 milliliters per day results in a positive reaction on a QUAC slide test. Individuals normally may lose up to 3 milliliters per day of blood in the feces, owing to minor insignificant abrasions of the nasopharynx and gastrointestinal tract, such as from brushing the teeth. To allow for normal blood loss, the QUAC slide test does not show a positive reaction until the blood in the stool reaches a level of 5 milliliters or more per day.
All right, very good. Lily, can you go ahead and read the next paragraph, please?
The QUAC slide test is a simple and inexpensive method to screen for the presence of fecal occult occult blood. However, care must be taken to reduce the occurrence of false positive and false negative test results. This test is designed to assess the presence of blood in stool specimens collected from 3 bowel movements on 3 different days. The purpose of using 3 specimens is to provide for the detection of blood from gastrointestinal lesions and inhibit intermittent bleeding, meaning they do not bleed every day. The patient must collect the 3 specimens at home and return the prepared slides to the medical office for developing. The medical assistant is responsible for providing the patient with instructions on patient preparation and collection and proper care and storage of the slides until they are returned to the medical office.
Very good. Okay, so in that paragraph, I want you ladies to highlight where it says the patient must collect the 3 specimens at home and return the prepared slides to the medical office for developing. All right, the purpose. The primary use for the Koek slide test is to screen the presence of occult blood caused by colorectal cancers. Other conditions that can cause blood in the stool include the following: hemorrhoids, anal fissures, colorectal polyps, diverticulitis, peptic ulcers, ulcerative colitis, gastroesophageal reflux disease, GERD, and Crohn's disease. A positive test result on the Quack slide test indicates only the presence of blood in the stool. Highlight that sentence. The source and the cause of the bleeding must still be determined. This means additional diagnostic procedures must be performed before the provider can make a final diagnosis. Highlight that sentence. These procedures may include colonoscopy, highlight that word, sigmoidoscopy, a double contrast barium enema radiographic study, virtual colonoscopy, computed tomography, CT colonography, and a newer procedure known as capsule endoscopy, which uses a tiny wireless camera that the patient swallows as a pill to take photographs of the digestive tract, which is pretty cool. Patient preparation. Patient preparation for the Quack slide test plays an important role in ensuring accurate test results. The patient must follow a special diet beginning 3 days before the test and must continue the diet until all 3 slides have been prepared. Highlight that sentence. The patient is placed on a high fiber, meat-free diet. Meat contains animal blood, which could lead to a false positive test result. A high fiber test is used because it encourages bleeding from lesions that may bleed only occasionally. Highlight those last 3 sentences. In addition, fiber adds bulk, which promotes bowel elimination and ensures adequate specimen collection. Certain medications irritate the gastrointestinal tract, which may result in a small amount of bleeding that could cause a false positive result on a Quack slide test. Highlight that sentence. Medications that should be avoided include ibuprofen, Motrin, Advil, naproxen, Aleve, and more than 1 adult aspirin per day. Highlight those 2 sentences. In addition, an iron supplement may cause a false positive result, and a vitamin C supplement greater than 250 milligrams per day can cause a false negative result. All of these substances should be discontinued before testing. Table 13.1 lists the specific patient preparation requirements for fecal occult blood testing using the Quack slide test. All right, Nancy, can you read the first paragraph under quality control? Natalie, can you please read the first paragraph under quality control? All right, Sabrina, can you please read the first paragraph under quality control?
Quality control methods must be employed by the Guyatt slide test to ensure reliable and valid results. It is important to properly store the box containing the Guyatt slides and developing solution. Adverse storage conditions can result in deterioration of the developing solution and the active reagents impregnated on the filter paper and slides, leading to inaccurate test results. The box must be stored at a room temperature between 59 degrees Fahrenheit and 86 degrees Fahrenheit. The contents of the box must be protected from the heat, sunlight, and strong fluorescent light. In addition, the box. Hold on, I lost my place. The box should not be stored in close proximity to volatile chemicals such as ammonia, bleach, bromine, iodine, disinfectant, cleaners. If stored properly, the slides and developer will remain effective until the expiration date that is stamped on the slide of the box. Each slide itself on the container of developing solution.
Very good. Okay, you're going to highlight where it says the box must be stored at a room temperature between 59 and 86 degrees Fahrenheit, and highlight the contents of the box must be protected from heat, sunlight, and strong fluorescent light. All right, Talia, can you please read the next paragraph?
A quality control procedure must be performed after the patient test has been developed and interpreted. The insurance that the test results be located on the of the corporate side. The during the manufacturing process.
All right, very good. Very good. Tina, are you where you? Can you read the last paragraph?
The medical assistant should apply one drop of between the positive and negative performance monitor areas on each of the 3 slides. The results must be read within 10 seconds after application of the developer. If the slides in the developer are functioning properly, the positive area turns blue, whereas the negative area shows no color change. Failure of of the expected control results to occur indicates an error. Excuse me, I have allergies this morning. And the tests are not considered valid. Possible causes the use of outdated slides or developing solution. An error in technique and subjection of the slides to heat, sunlight, and strong fluorescent lights or volatile chemicals. Procedure 13.1 outlines the medical assistant's responsibilities related to fecal occult blood testing using the Hemoccult Coax slide test. Procedure 13.2 describes the development of a Hemoccult slide test.
Very good. Okay, you're going to highlight where it says failure of the expected control results to occur indicates an error and the test results are not considered valid. Possible causes include the use of outdated slides or developing solution, an error in technique, and subjection of the slides to heat, sunlight, strong fluorescent light, or volatile chemicals. Okay, really quickly on table 13.1 on page 506, I want you to highlight by vegetables, highlight the last 2 sentences. On medications, highlight the first sentence. And the 4th sentence. And on special guidelines, highlight do not initiate the test during a menstrual period or in the first 3 days after a menstrual period. I can't talk either this morning, guys. All right, case study number 1. Beatrice Bernard is 52 years old and has come up to the office for a physical examination. The physician wants Miss Bernard to perform a Hemocolt test. After being told the purpose of the test and how to prepare for it, Miss Bernard expresses some concerns. She does not like the idea of what she has to do to perform the test because it does not seem sanitary to her. She also thinks it will be a lot of work to prepare for the test. She has red meat for dinner at least 4 times a week, and she does not understand why she has to eliminate it from her meals. She says she takes a baby aspirin every day for heart health and would prefer to not stop taking it. Miss Bernard says that she has always taken very good care of herself and she has never had problems with her colon. She also says no history of colon cancer has been reported in her family. Miss Bernard is too embarrassed to talk about this topic with the physician. She says she may just throw the test away when she gets home. All right. So what do we do?
First, we make sure the importance of early detection. So we're not saying that something is wrong, but let's make sure that something is, and try to make her feel more comfortable and not being embarrassed about having to perform the test, and explain to her she can still take her 1 aspirin every day.
Mhm.
And that, you know, we handled these tests and handled it's nothing to be ashamed of. We deal with reading these tests and the tests being brought back to us on a daily basis. Just try to make her feel comfortable.
Right. I mean, she's hesitant about the preparation, but we have to remind the patients that, yeah, preparation's not too fun for even this, but it's not near what it is if you do a colonoscopy, right? So, you try to just want to kind of understand. I mean, we understand she feels hesitant, but, early is the prior key. We're not saying, like you said, Tina, we're not saying that something's wrong, but we also don't want something to be wrong and we not know about it. So this way we can clear that with doing this type of simple procedure. Very good. All right, anything else? Does anyone know when colon cancer starts increasing the risk? Of what age?
40s or 50s?
50s. That is out history. So that's why you may hear, especially as a medical assistant, even in our family practice, when our coming in for their yearly exam, you may hear your physician ask them, have you had your colonoscopy screening yet? No, no, no. Well, it's time for us to go ahead and do that. So that's something. So at age 50, your increased risk of having colorectal cancer starts to become detectable. And so that's the main purpose of why most individuals are requested to start having colonoscopies at the age of 50. And again, that is without family history. All right. Does anybody know what else you would do or what we don't want to do? No? Okay. So turn to page 509. Other types of stool test. 2 types of newer tests are now available to screen for colorectal cancer. They include the fecal immunochemical test and the fecal DNA test. Fecal immunochemical test. Alicia, can you please go ahead and read that?
The fecal immunochemical test, FIT, is a fecal occult blood test that uses antibodies to detect blood in the stool. Examples of brand names for this test are Hemoccult ICT and QuickView IFOB. The stool specimen for an FIT is collected by the patient at home and then returned to the medical office for interpretation. Because the method used to collect the stool specimen varies based on the brand of test used, it is important for the medical assistant to become completely familiar with the FIT test used in his or her office by reading the product insert that accompanies the testing kit. The medical assistant is responsible for providing the patient with instructions for collection of the specimen and proper care and storage of the specimen until it is returned to the medical office. Although the FIT is more expensive than the what'd you say, guac, right? Or something like that?
Quack.
Quack. Slide test, it is more sensitive in the presence of lower gastrointestinal GI bleeding than it is in the guac test. This test is not affected by drugs or food and therefore does not require medication or dietary restrictions. In addition, FIT has fewer false positive test results in the guac test slide test. When a fecal occult blood test is positive, the patient must undergo a colonoscopy. Reducing the number of false positive test results in turn reduces the number of unnecessary colonoscopies.
Yes, very good. Okay. So in the last paragraph, I want you guys just to highlight the first sentence. Any questions so far? All right, you guys are quiet today. All right, fecal DNA test. Anna, can you go ahead and read the fecal DNA test, please?
Yes. A fecal DNA test, Cologuard, is the newest type of colorectal screening test, and its advantage and disadvantage are still being investigated. This test uses DNA technology to detect abnormal cells that are shielded to the stool from cancerous growth cells or colorectal polyps. The test also detects the presence of oculate blood in human stool. The fecal DNA test is much more expensive than other forms of stool testing. It is not routinely covered by the health insurance. No special preparation is needed for this test. The patient is required to collect an entire stool sample in a special container. The patient must then immediately pour a preservation over the stool specimen and seal the container. The container is placed in a shipping box and mailed to a laboratory within 24 hours after collection. When a fecal DNA test is positive, the patient must undergo a colonoscopy.
Very good. Okay, so a lot of primary care doctors are using the Cologuard. And I mean, and it's great, right? It's easier. And if we don't have to have our patients go through a colonoscopy, we don't want them to. But because this test is still so new, um, our results can still vary. Like my mom had to do a Cologuard, it came out positive. So she was referred to a colonoscopy where her colonoscopy was normal. So, it's kind of, we're trying to do everything we can to prevent our patients from having to undergo some testing. It's not so much that it's not necessary, it's just, colonoscopy is not, I think most women would rather have a mammogram done than a colonoscopy, right? So if we don't have to put our patients through that, we don't want to. But again, because that test is still so new, they can't say for certain the accurate of the results. So one thing to keep in mind is that if your doctor does give your patient a Cologuard, let them know that this is just a type of test to see if we even need to do a colonoscopy. and it's not a guarantee that you still won't have to. Okay? Any questions on that? Okay. If you will turn your book to page 512, I would like for you to highlight the second sentence under 3 procedural steps. And then Jasmine, if you can go ahead and read sigmoidoscopy, please.
Sigmoidoscopy is a visual examination of the mucosa of the rectum and the lower third of the colon using a flexible fiber optic sigmoidoscope. Before a patient undergoes a sigmoidoscopy, the provider explains the nature of the procedure and any risks to the patient and offers to answer questions. The medical assistant is responsible for obtaining the patient's signature on a written consent to treatment form, which grants the provider permission to perform the procedure. Do I keep reading?
Very good.
Or no?
No, you're good. Okay, just highlight the first sentence. All right, Lily, are you where you can read purpose?
Yes. Sigmoidoscopy may be performed following a positive fecal occult blood test to determine the source and cause of the bleeding. It is also performed to evaluate patient symptoms related to the colon, such as lower abdominal pain, diarrhea, and constipation. Conditions that can be detected and assessed during a sigmoidoscopy include lesions, polyps, hemorrhoids, fissures, infection, and inflammation. It is especially valuable at a diagnostic procedure for detecting inflammatory bowel disease such as ulcerative colitis and Crohn's disease.
Go ahead and read that next paragraph for me.
A sigmoidoscopy has certain limitations because a sigmoidoscopy reaches only the lower third of the colon. The provider may not be available to determine the cause of the patient's symptoms. In this situation, the provider may order a colonoscopy to be performed at a later date. If the sigmoidoscopy detects the presence of precancerous polyp or colorectal cancer, the colonoscopy must be performed to detect additional tumors or cancer that may be present in the rest of the colon.
All right, very good. Thank you. Okay, so on page 513, I just want you to highlight where it says conditions that can be detected and assessed during a sigmoidoscopy include lesions, benign or malignant tumors, polyps, hemorrhoids, fissures, infections, and inflammation. All right, so really quickly before we read the patient preparation for sigmoidoscopy, I want you to look at figures 13.4 on page 514. So the difference between a sigmoidoscopy and a colonoscopy is that a sigmoidoscopy is only going to do just a portion of the colon, right? You see where it's kind of a yellow? That's as far as the camera. A colonoscopy actually goes all the way up into the ascending colon. So it goes much further into the colon. That's the difference between the two. All right, any questions? Okay, Natalie, can you please read patient preparation for sigmoidoscopy?
The patient is required to prepare the period before sigmoidoscopy. The lower third of the colon must be flushed out completely so that it is empty and free of fecal material. This is known as partial bowel prep. Because only a portion of the colon needs to be prepared, bowel preparation is one of the most important parts of the sigmoidoscopy. Fecal material can interfere with good visualization of the wall of the colon, making it difficult for the provider to detect abnormalities. The medical assistant is responsible for providing the patient with instructions on preparing the colon. The medical assistant should encourage the patient to follow the instructions exactly. If the patient does not prepare properly, the sigmoidoscopy is usually canceled and must be rescheduled, which requires the patient to go through the bowel preparation procedure again. The patient preparation instructions may vary slightly from the one facility to another. General patient preparation recommendations for a sigmoidoscopy are outlined in Table 13.2.
All right, very good. So you're going to highlight the second sentence in the first paragraph. Digital rectal examination. A digital examination of the anal canal and rectum is performed during a sigmoidoscopy. Using a well-lubricated gloved index finger, the provider palpates the rectum for the presence of tenderness, hemorrhoids, polyps, and tumors. Highlight that sentence. Any palpable abnormality is viewed directly with the endoscope is inserted. An endoscope is an instrument, for example, a sigmoidoscope or colonoscope, that consists of a tube and an optical system that is used for direct visual inspection of the organs and cavities. The digital examination also helps relax the sphincter muscles of the anus and prepares the patient for the insertion of the endoscope. Highlight that last sentence. Sigmoidoscope. A flexible fiber optic sigmoidoscope consists of a control head and a long flexible insertion tube attached to a light source. The insertion tube is 1/2 inch in diameter and 24 inches long, which allows the provider to view approximately 1/3 of the colon, which includes the rectum and sigmoid colon. The sigmoidoscope is composed of extremely thin fibers of bendable glass that transmit light and images to the colon back to the provider. The image, magnified 10 times by the fiber optic system, is viewed by the provider through the eye lens located in the handle of the sigmoidoscope. Alternatively, the sigmoidoscope may have a video camera attached to the distal end of a flexible insertion tube, which permits the provider to view images of the colon and rectum on a display screen, which is more commonly on what they use. All right, so before we read the purpose, I want you ladies to go ahead and look at table 13.2 on 515. Highlight the following. The day before the procedure and continuing until your examination is completed. Then across from that, highlight the do not consume any solid food or milk products and drink only clear liquids. The evening before the procedure, and also highlight the drink the following laxative. Highlight the day of the procedure, and highlight 2 hours before. Insert 1 Fleet's enema. 1 hour before the procedure, insert another Fleet's enema. Now, guys, I know this doesn't sound fun at all, but it's very important. As a medical assistant, the last thing you is your patient to have to redo this test. So it is very, very, very important that you explain the preparation to your patient and you make sure they understand it. So if we got, I know, I've been through a colonoscopy many times, so you definitely don't want to do this again. The one thing is to understand what is a clear liquid. Is a Dr. Pepper a clear liquid? No, it is not considered a clear liquid. Is Sprite a clear liquid?
Is what?
Would Sprite be considered a clear liquid?
Yes and no.
Right. So it is considered a clear liquid. However, the carbonation can cause the patient a lot of gas, right? And the patient's already going to have a lot of that. So you can do, the best thing is water. You can do Gatorade. Now, however, if your patient is having to do one of these tests and are diabetic, do you think it's recommended for them to drink a Gatorade? Right. No, they either need to do the lower sugar count Gatorade or just stick with water, because their sugar levels are already going to be haywire during this test. Now, about eating. So we cannot consume any solid food. So what are some alternatives that the patient can do? Any ideas?
Jello, maybe?
Jello. All right. Now, let me ask you, Tina, what color of Jello?
I would say they definitely do the red Jello.
That's right.
Like lower.
Yep, you have to stay away no matter what you drink or what Jello you eat, even popsicles. Stay away from red, purple, and blue. And can anybody tell me why?
The dye, the red dye.
Yes. What's going to happen with the red dye in this test?
Isn't it going to dye the intestine?
It's going to make it look like there might be blood when there's not. It's because of the dye. So you can do green, orange, yellow. You can do applesauce, Alicia, but it's got a little bit more of a solid texture, right? You want to stick to as much see-through items as you can. So you can do broth, you can do Jello, you can do popsicles, you can do Gatorade, you can do water. Some of my patients would do unsweet tea. I don't highly recommend it as an option because, again, it's kind of like a Dr. Pepper look, right? You still got a cloudy, and you really want to do as much clear see-through as possible. All right, any questions on that? All right. Sabrina, can you please read the first paragraph under the purpose?
Colonoscopy is often performed following a positive fecal occult blood test to determine the source and the cause of the bleeding. It is also performed to evaluate patient symptoms related to the colon, such as a lower abdominal pain. Colonoscopy is considered the gold standard for assessing abnormalities of the colon. Conditions that can be detected and assessed during the colonoscopy include the following: lesions of the colon and rectum, colorectal polyps, hemorrhoids, fissures, infection, and inflammation.
All right. Okay, so you're going to highlight the first sentence. And then highlight where it says a small amount. Do what?
Weren't we under procedure under sigmoidus? Was it the wrong place?
The purpose under the sigmoidoscope on page 515.
That's not what she just read. You read colonoscopy.
Well, that's what I was kind of looking at. All right, Sabrina. It's all right. It's been a day. Okay. Yeah, because I was like, wait a minute, that's sounded kind of weird. Okay. So, okay, so for the purpose on page 514, highlight when the sigmoidoscopy is performed, the patient is placed on his or her left side in the Sims position. The distal end of the sigmoidoscope is lubricated and inserted into the anus and rectum and then slowly advanced into the colon until it reaches the sigmoid colon. A small amount of air is usually blown or insufflated into the colon through tubing attached to the air control valve located on the head of the sigmoidoscope. Highlight that sentence. The function of the air is to distend the lumen of the colon for better visualization. In addition, suction equipment can be used to remove secretions such as mucus, blood, and liquid feces, which interfere with proper visualization of the intestinal mucosa. The provider then slowly withdraws the sigmoidoscope while carefully observing the mucosa of the colon for abnormalities. If the provider discovers an abnormal lesion during the examination, a long, thin instrument is passed through the lumen of the insertion tube to remove a specimen for biopsy. In addition, if a suspicious-looking polyp is discovered, the provider may remove it, a polypectomy, or take a biopsy sample of it for analysis by the laboratory. Removal of a precancerous polyp prevents it from developing into colon cancer in the future. Page 516. The medical assistant must prepare the patient for the procedure and assist the provider during the sigmoidoscopy. Highlight the following. The responsibilities include the following. Determine whether the patient has prepared properly for the sigmoidoscopy. Ask the patient whether he or she needs to void before the procedure. Most of the time they do. Position and drape the patient in Sims position. Reassure the patient and help him or her to relax. Lubricate the provider's gloved index finger for the digital examination. Lubricate the distal end of the sigmoidoscope before the provider inserts it. Assist with suction equipment. Assist with the collection of a biopsy specimens by holding the specimen container to accept the specimen. Assist the patient after the examination. Prepare the biopsy specimen for transport to the laboratory. Clean the examining room and sanitize and disinfect the sigmoidoscope. Now, after reading that, do you think this is done in the clinic or in the hospital?
Clinic?
Yes. So it actually is done probably more so than clinic than sometimes hospital. It kind of depends on the patient. But this type of procedure can be done in the clinic, unlike a colonoscopy. But this type of procedure can be done in the clinic. All right, very good. Let's go ahead and read our case study number 2. Mr. Frederick Mitchell is 57 years old and is the president of the bank. 2 weeks ago, he performed Hemoccult testing at home, and 2 of the 3 slides were positive. His physician ordered a sigmoidoscopy as a follow-up to help determine whether a problem could be identified. Mr. Mitchell has come to the office for his sigmoidoscopy. Mr. Mitchell says that he was called out of town unexpectedly on business and was not able to perform the patient preparation. But he says that it is fine for the physician to go ahead and perform the procedure anyway.
So you would have to explain to him it has to be scheduled.
Yep.
If he didn't follow the preparation, the test wouldn't have inaccurate results. So there was no way to
That's right.
do the test if he didn't prep.
Yep, very good. All right, anything else? probably the biggest one, right? I mean, we don't want to make him feel bad, right? I mean, we understand things come up, but we also don't want to put the patient through something. Exactly. Yeah, we understand things happen, but in order for us to get accurate results and not have to do follow procedures, then we need him to do the preparation. So it would just be better for him just to reschedule, do the preparation, come back, we'll get the test, and all be done. Yep. So very good. Okay. Now for colonoscopy. Yay. All right. Talia, can you please read the first two paragraphs?
Colonoscopy.
Yes. Colonoscopy.
A colonoscopy is the individual examination of the rectum and the internal length of the colon. Sigmoid colon, descending colon, colon scope, a sigma, but with a longer insertion tube. The colon scope has a camera distal end of the flexible insertion tube. The camera transmits images of the colon to a video screen for viewing by the provider. Figure 13.4. Before a patient undergoes a colonoscopy, the provider explains the nature of the procedure and any risk to the patient and offers to answer questions. The medical assistant may be responsible for obtaining the patient's signature on a written consent to treatment form, which grants the provider permission to perform the procedure.
Very good. Thank you. Okay, you're just going to highlight the first sentence of the first paragraph. So if you ever, and I know most of you probably have not right at this point, but if you ever do get to view images from a colonoscopy, it's actually pretty cool. Some of the things that you might see. All right. Purpose. A colonoscopy is often performed following a positive fecal occult blood test to determine the source and the cause of the bleeding. It is also performed to evaluate patients' symptoms related to the colon, such as lower abdominal pain. Colonoscopy is considered the gold standard for assessing abnormalities of the colon. Conditions that can be detected and assessed during a colonoscopy include the following: lesions of the colon or rectum, benign or malignant growths, colorectal polyps, hemorrhoids, fissures, infection, and inflammation. Colonoscopy is particularly valuable for the early detection of symptomatic and asymptomatic colorectal cancer. Early detection of colorectal cancer leads to early diagnosis and treatment, which increases the chance of survival for patients with this disease, and I cannot agree more. All right, let's go to page 517. Really quickly look at figure 13.8. So this is actually what a colon polyp looks like. And if you can imagine, this size of a polyp probably was causing some obstruction for the patient, right? I mean, it's basically almost taken up half of the colon canal. So that's just kind of an example of what a colon polyp looks like. All right, patient preparation for colonoscopy. Tina, can you go ahead and read that, please?
A colonoscopy is usually performed in a hospital or in a large medical clinic. The rectum and the entire colon must be flushed out completely so that it's empty and free of fecal material. This is known as a full bowel prep. This is one of the most important parts of the colonoscopy. Fecal material can interfere with good visualization of the wall of the colon, making it difficult for the provider to detect abnormalities. The medical assistant may be responsible for providing the patient with instructions on preparing the colon. The patient should be encouraged to follow the instructions exactly. If the patient does not prepare properly, the colonoscopy is usually canceled and must be rescheduled, which requires the patient to go through the bowel preparation procedure again. The patient preparation instructions may vary from one facility to another. General patient preparation recommendations for colonoscopy are outlined in Table 13.3, along with patient instructions following the procedure.
Very good. Okay, you're just going to highlight the second sentence in the first paragraph. All right, Alicia, can you please read procedure on page 518?
Sorry, I'm highlighting. Okay.
It's okay.
A sedative is administered intravenously before the colonoscopy. The sedative causes the patient to become relaxed, sleepy, and less aware of what is taking place. Some patients do not remember the procedure at all afterward. The procedure itself is similar to the sigmoidoscopy. The patient is placed on his or her left side in the Sims position. The provider performs a digital rectal examination before inserting the colonoscope. The colonoscope is advanced all the way through the entire colon, approximately 4 to 5 feet, until it reaches the cecum. Air is inserted into the colon to distend it for a better visualization. Suction is used to remove secretions such as mucus, blood, and liquid feces that interfere with proper visualization. The provider then slowly withdraws the colon. I don't know why I can't say that right now. Because I'm used to saying colonoscopy, and now that it's just scope, it sounds weird.
Okay.
A colonoscope while carefully observing the mucosa of the colon for abnormalities. If the provider discovers an abnormal lesion, a long, thin instrument is passed through the lumen of the insertion tube to remove a specimen for a biopsy. In addition, if a suspicious-looking polyp is discovered, the provider may remove it. Polypectomy, I'm sorry, or take a biopsy of it for analysis by the laboratory. Removal of precancerous polyp prevents it from developing into colon cancer in the future. Following the procedure, the patient may experience some bloating, abdominal cramping, and flatulence. If a polyp has been removed or if a biopsy has been performed, the patient may exhibit traces of blood in the stool for 1 to 2 days. Sorry.
No, you're good. You're good. You guys are good. All right. Any questions over colon procedures? All right. So now we're going to talk about the male reproductive health. The last part of this, we're actually almost done with this chapter, but we're going to hit on some pretty important things for our male reproductive health. Introduction to male reproductive health. Two important areas related to male reproductive health are prostate screening and testicular self-examination. Preventative examination and tests can assist in the detection of prostate and testicular cancers. Both of these areas are described in the following section. So, ladies, just like we have BSE, which stands for
Breast self-examination.
That's right. Our men have TSE, testicular self-examination. Okay? Prostate cancer. Anna, can you please read prostate cancer?
According to the American Cancer Society, prostate cancer is the most common causes of cancer deaths in men. Lung cancer being the most common. Every year, approximately 24. Is that 24 million?
240,000.
240,000 men are diagnosed with prostate cancer, and approximately 28,000 die from this disease. The instance of prostate cancer increases after age 50. Prostate cancer is found more often in African American men and men with a family history of prostate cancer. The prostate gland surrounds the urethra and is located between the bladder and in front of the rectum. Figure 13.9. It is approximately the size and the shape of a walnut, and its function is to secrete fluid to transport sperm. In the early stages, prostate cancer often causes no symptoms that occur when the cancer is more developed, including the following: difficulty urinating, weak or interrupted urine flow, pain or burning during urination, frequent urination, especially at night, blood in the urine, pain in the lower back, pelvis, and upper thigh.
All right, very good. So you're actually going to highlight all of that last paragraph, including those bullet points. All right, prostate cancer screening. The primary screening tests for prostate cancer are the digital rectal examination, DRE, and the prostate-specific PSA test. The digital rectal examination is a quick and simple procedure that causes only momentary discomfort. During the examination, the provider inserts a lubricated gloved finger into the patient's rectum. Because the prostate gland is located in front of the rectum, the provider is able to palpate the surface of the prostate gland through the rectal wall. See figure 13.9. The provider palpates the gland to determine whether it is enlarged or has an abnormal consistency. Highlight: normally the prostate gland should feel soft, whereas malignant tissue is firm and hard. The sensitivity of the DRE is limited. However, because the provider can palpate only the posterior and lateral aspects of the prostate gland. Prostate-specific antigen test, PSA test, is a screening test that measures the amount of PSA in the blood. PSA is a protein normally produced by the cells of the membrane that covers the prostate gland. Highlight: the normal range for PSA is 0 to 4. The PSA level may become elevated in men who have a benign or malignant growth in the prostate. A PSA level of 4 to 10 is considered slightly elevated. Levels between 10 and 20 are considered moderately elevated, and a value greater than 20 is considered highly elevated. The higher the PSA level, the more likely the cancer is present. Other conditions other than prostate cancer that can cause an elevated PSA level include benign prostatic hyperplasia and prostatitis. Highlight those last two sentences. The PSA level may normally increase after vigorous exercise such as jogging or biking. Highlight that sentence. The medical assistant should instruct the patient to engage only in normal activity for 2 days before having blood drawn for a PSA test. The patient should also be instructed not to have sexual intercourse for 2 days before the test because it can change the PSA level. If the DRE is abnormal and/or the PSA test is elevated, further testing may be performed to determine whether prostate cancer is present. To make this assessment, one or more of the following tests may be performed: rectal ultrasound, TRUS, biopsy of the prostate gland, bone scan, and computed tomography CT scan. Highlight that last sentence. Recommendations for prostate screening. Jasmine, can you please read the first and second paragraph?
Screening refers to the process of testing to detect a disease in an individual who is not yet experiencing symptoms of that disease. For certain types of cancer, such as colorectal cancer, cervical cancer, screening allows the cancer to be discovered early when it is more treatable, which increases the patient's survival rate. The DRE and PSA screening tests for prostate cancer have certain limitations. Abnormal results from both of these tests do not necessarily indicate that cancer is present. In addition, normal results from these tests do not mean that cancer is not present. An elevated PSA test may lead to a biopsy and the detection of cancer in an individual, which can pose a dilemma. Many prostate cancers are slow growing and do not result in an individual's death, particularly if the man is older or in poor health. Because it is sometimes difficult to determine the aggressiveness of the cancer, these individuals may still be treated with surgery or radiation, which can seriously affect a man's quality of life.
Very good. Lily, can you go ahead and read the next paragraph? Natalie, can you please read the next paragraph?
Where it says DRE.
No, where it says the American Cancer Society, ACS.
The American Cancer Society, ACS, believes that available evidence does not currently support routine testing for prostate cancer. The ACS recommends that healthcare providers discuss the potential benefits and limitations of prostate screening with men older than 50 years of age. Following the discussion, the PSA test and the DRE should be offered annually to men 50 years and older who are at average risk for prostate cancer and have at least a 10-year life expectancy. Those men who indicated preference for testing should be tested. The ACS recommendation provides men with a knowledge of the advantages of and disadvantages of early detection and treatment of prostate cancer, which then allows them to share in the decision of whether or not to be tested.
All right, very good. Thank you. So guys, just like ladies, so just like we do our BSE and just like at a certain, like our colonoscopy screening started at age 50, mammograms will start at a certain age for women. We also have male health too that follows guidelines. And for them, this would be for their prostate area. All right, any questions so far?
Question.
Yes.
So can men younger than 50 years get prostate cancer? Like, is there like a slight chance that they can get it?
No, I mean, it's, I think because testing is more available now that more men will be diagnosed with it, but not all men, right? It's if you have a family history of prostate cancer, then you want to make sure that you get tested. But it is very important because the symptoms of having even an enlarged prostate for men is like a severe bladder infection for a woman, right? It's uncomfortable. Just like for women, it's uncomfortable for men too. But their treatment options can vary. So it's basically just up to that patient.
Okay.
Any other questions?
No, ma'am.
Okay. All right. Does anybody have a family history of prostate cancer in their family? I do. Yeah, and you may not, because again, this is more of a male health, and some men don't even like talking about it. So the one side as a medical assistant is, again, you always want to make sure your patients are able to talk to you, that they're comfortable. Yes. Yeah. Prostate cancer is very highly, prostate cancer, colon cancer, and melanoma run very high in my family. Prostate cancer can be, as long as you detect it early, a patient can have a great quality of life. All right, case study number 3. Peter Bota, a 62-year-old retired Caucasian male, came to the medical office 1 week ago for a physical examination. The physician performed a DRE but did not palpate anything abnormal. At that visit, Mr. Bota's blood was drawn for a PSA test and the result came back as slightly elevated. Mr. Bota has returned to the office and is waiting to talk with the provider about his test results and a possible follow-up testing. Mr. Bota is extremely worried that he has cancer and wants to know the symptoms of prostate cancer. He also wants to know whether he did anything to cause prostate cancer. He says he does not smoke, drinks very little, and walks his dog twice a day for exercise. All right, medical assistants, what would you do?
Um, we could just explain to him deeper that the PSA is normally produced by the cell. So it's not necessarily something that he should worry about since it's only slightly elevated and not considered, like a greater risk.
Right.
I guess just answer his question to the best of your abilities, and if you don't know the answers, tell your provider.
Yeah, so for this particular case, the one thing that I want you guys to notice is that he walks his dog twice a day for exercise. Now, what is something that could elevate a PSA, even slightly?
Exercise.
Yep. So you might ask him, when was the last time that you walked your dog? And if he said, even if it was within a couple of days of him getting that test, that might explain why it's elevated. And generally, even if something is slightly elevated, you remember we kind of went over our hemoglobin A1C, right, and our glucose. It's maybe repeated in 3 months. Possibly we might just repeat his levels in 3 months and remind him of the instructions that he needs to follow, right? No exercising, try to do normal activity, a couple of days prior, so that way we might can get a little bit better accurate levels. But yeah, I mean, this one, you don't want him to become concerned because, again, it's only slightly elevated and things can even cause that for it to be elevated. But we also don't want him to pass this off like nothing's wrong, right? We want him to stay on top of his health. So that's good. All right, anything else? Okay. Testicular self-examination. The purpose of testicular self-examination, TSE, is early detection of testicular cancer. Since the 1970s, testicular cancer among young Caucasian men has more than doubled. Although testicular cancer can develop at any age, it is most common in males 15 to 34 years old. Highlight that sentence. If detected early, it has a very high. Most cases of testicular cancer by men themselves, either by accident or performing a TSE. And ladies, just remember when we do our BSEs, that is also how the early detection begins, right? We are becoming more familiar of our own body. Certain risk factors increase a man's chance of getting testicular cancer include the following. Highlight that in the following bullet points. History of cryptorchidism, undescended testicles, family history of testicular cancer, cancer of the other testicle, Caucasian race. Testicular cancer is 5 times more common in Caucasian men than in African American men. TSE should be performed monthly starting at 15 years of age. Highlight that sentence. A good idea is for the patient to choose an easy to remember date each month, such as the first date of the month. The best time to perform the examination is after taking a warm bath or shower. Highlight that sentence. Heat allows the scrotal skin to relax and become soft, making it easier to palpate the underlying testicular tissues. The most common sign of testicular cancer is a small, hard, painless lump about the size of a pea located on the front or side of the testicle. Highlight that sentence. Any abnormality of the testicle should be reported to the provider immediately. It does not mean that the patient has cancer. However, the provider must make that determination. Figure 13.10 outlines the procedure for the TSE. Check out the Evolve site to access interactive activity, procedure videos, and other helpful study resources. All right, and ladies, that concludes chapter 13. Any questions? All right, So this chapter is pretty cool. It's a lot of great information. It's very interesting to me after being in the field. So just make sure that you, oh, what you got, Alicia? That's a good question. It's just part of the gene. Like, I believe breast cancer is more common in, what is it, African American women, and we don't really know the reason for that. Now, let me ask you guys this. Can men get breast cancer? Yes, they can. So yeah, it's just part of the, just part of that gene. Any other questions? That's a good one. All right. All right, ladies, you did very well. Make sure you send me your Chapter 7 study guide results. And then don't forget to send me Chapter 18 and 19 study guide results if you've not done so already. At 1 o'clock, we will do our open floor discussion, and we can discuss absolutely anything, any chapters, any material, any questions. And then I think that that is it for the day. I will let you ladies go, and then if you want, you're more than welcome to hop on at 1 o'clock. You're welcome.